Question 51. When teaching a female patient how to take a sublingual tablet, the nurse should instruct the patient to place the table on the A. Top of the tongue, B. Roof of the mouth, C. Floor of the mouth, D. Inside of the cheek. Answer C. Explanation. The nurse should instruct the patient to touch the tip of the tongue to the roof of the mouth and then place the sublingual tablet on the floor of the mouth. Sublingual medications absorbed directly into the bloodstream from the oral mucosa, bypassing the GI and hepatic systems. No drug is administered on the top of the tongue on the roof of the mouth. With the buccal root, the tablet is placed between the gum and the cheek. Question 52. Which action by the nurse in charge is essential when cleaning the area around a Jackson Brett wound drain? A. Cleaning from the center outward in a circular motion. B. Removing the drain before cleaning the skin. C. Cleaning briskly around the site with alcohol. D. Wearing sterile gloves and a mask. Answer A. Explanation. The nurse always should clean around a wound drain, moving the center outward in ever larger circles, because the skin near the drain site is more contaminated than the site itself. The nurse should never remove the drain before cleaning the skin. Alcohol should never be used to clean around a drain. It may irritate the skin and has no lasting effect on bacteria because it evaporates. The nurse should wear sterile gloves to prevent contamination, but a mask is not necessary. Question 53. The doctor orders dextrose 5% in water, 1000 ml to be infused over 8 hours. The IV tubing delivers 15 drops per millimeter. The nurse in charge should run the IV infusion at a rate of A. 15 drops per minute, B. 21 drops per minute, C. 32 drops per minute, D. 125 drops per minute. Answer C. Explanation. Giving 1000 ml over 8 hours is the same as giving 125 ml over 1 hour 60 minutes to find the number of millimeters per minute. 125 per 60 minutes equals x per 1 minute. 60x equals 125x equals 2.1 millimeters per minute. To find the number of drops per minute, 2.1 millimeters per x drops equals 1 millimeters per 15 drops. X equals 32 drops per minute or 32 drops per minute. Question 54. A female patient undergoes a total abdominal hysterectomy. When assessing the patient 10 hours later, the nurse identifies weak finding as an early sign of shock. A. Restlessness. B. Pale, warm, dry skin. C. Heart rate of 110 beats per minute. D. Urine output of 30 millimeters per hour. Answer A. Explanation. Early in shock, hyperactivity of the sympathetic nervous system causes increased epinephrine secretion, which typically makes the patient restless, anxious, nervous, and irritable. It also decreases tissue perfusion to the skin, causing pale, cold, clammy skin. An above normal heart rate is a late sign of shock. A urine output of 30 millimeters per hour is within normal limits. Question 55. Which pulse should the nurse palpate during rapid assessment of an unconscious male adult? A. Radial, B. Brachial, C. Femoral. D. Carotid. Answer D. Explanation. During a rapid assessment, the nurse's first priority is to check the patient's vital functions by assessing his airway, breathing, and circulation. To check a patient's circulation, the nurse must assess his heart and vascular network function. This is done by checking his skin color, temperature, mental status, and most importantly, his pulse. The nurse should use the carotid artery to check a patient's circulation. In a patient with a circulatory problems or history of compromised circulation, the radial pulse may not be palpable. The brachial pulse is palpated during rapid assessment of an infant. Question 56. Which intervention is an example of primary prevention? A. Administering digoxin to a patient with heart failure. B. Administering a measles, mumps, and rubella immunization to an infant. C. Obtaining a Papa Nicolau smear to screen for cervical cancer. D. Using occupational therapy to help a patient cope with arthritis. Answer B. Explanation. Immunizing an infant is an example of primary prevention, which aims to prevent health problems. Administering digoxin to treat heart failure and obtaining a smear for screening tests are examples for secondary prevention, which promotes early detection and treatment of disease. Using occupational therapy to help a patient cope with arthritis is an example of tertiary prevention, which aims to help a patient deal with the residual consequences of a problem or to prevent the problem from recurring. Question 57. The nurse's charge is assessing a patient's abdomen. Which examination technique should the nurse use first? A. Auscultation. B. Inspection. C. Percussion. D. Palpation. Answer B. Explanation. Inspection always comes first when performing a physical examination. Percussion and palpation of the abdomen may affect bowel mobility and therefore should follow auscultation. Question 58. Which statement regarding heart sounds is correct? A. S1 and S2 sound equally loud over the entire cardiac area. B. S1 and S2 sound fainter at the apex. C. S1 and S2 sound fainter at the base. D. S1 is loudest at the apex and S2 is loudest at the base. Answer D. Explanation. The S1 sound, the lap sound, is loudest at the apex of the heart. It sounds longer, lower, and louder than the S2 sounds. The S2, the dub sound, is loudest at the base. It sounds shorter, sharper, higher, and louder there than S1. Question 59. The nurse in charge identifies a patient's responses to actual or potential health problems during which step of the nursing process? A. Assessment. B. Nursing diagnosis. C. Planning. D. Evaluation. Answer B. Explanation. The nurse identifies human responses to actual or potential health problems during the nursing diagnosis step of the nursing process. During the assessment step, the nurse systematically collects data about the patient or family. During the planning step, the nurse develops strategies to resolve or decrease the patient's problem. During the evaluation step, the nurse determines the effectiveness of the plan of care. Question 60. A female patient is receiving furosemide, Lasix, 40 milligrams PO bit in the plan of care, the nurse should emphasize teaching the patient about the importance of consuming A. Fresh green vegetables, B. Bananas and oranges, C. Lean red meat, D. Creamed corn. Answer B. Explanation. Because furosemide is a potassium-wasting diuretic, the nurse should plan to teach the patient to increase intake of potassium-rich foods such as bananas and oranges. Fresh, green vegetables, lean red meat, and cream corn are not good sources of potassium. Thank you for watching.